Good morning, dear student. This is Dr. Rathod, Department of Forensic Medicine, online class from Sir Lakshmi Narayana Institute of Medical Science, Puducherry. Very good morning. It's audible. Hope so. Yes? Shall I start? Yes. Thank you. Okay. Yeah. Let's start. Forensic psychiatry. It needs 4 hours to complete. Part of the hours has been given to integration class, psychiatry department and Department of Forensic Medicine jointly conduct integration class. Part on the theory classes. We try to make a simple, very simple. On today's class, we don't have any character which distract your mind. No pictures, nothing. Just text, be with me. I'll finish within half an hour. And it will not take. A part I'm taking, not a complete class. Okay? And you will find definition of health everywhere. Then you join. Just refresh your memory. It has been again. You will find in medicine, community medicine, forensic medicine, all the classes, the beginning you will take what is the health. It is defined as a state of complete physical, mental, social well-being, not merely absence of the disease or infirmity. That's a WHO definition, 1948. And you have seen that complete physical, mental, and social well-being, and not merely absence of the disease or infirmity. Has been mentioned mental. What is the mental health? Has been defined as state of balance between the individual and surrounding world. What state? State of a balance between the individual and surrounding world. A state of harmony between the oneself and others. A coexistence between the realistic of the self and coexistence between the realities of the self and that of other people and that of the environment. That is a definition of mental health. Now comes to know the psychiatry. What is the psychiatry? It's deal with the study of diagnosis and treatment of mental illness. That is a psychiatry, but here word has been tagged with a forensic. I'm not going to teach a complete psychiatry. Near future, recent future, you will learn a psychiatry in detail. Here, law in relation to medical man, that is a specialist branch of the psychiatry related to cases, the mental illnesses. So forensic psychiatry is application of psychiatry for the purpose of law and administration of justice. A part I'll see that related to law, to the psychiatrist. It is a branch of medicine related to interface between the law and psychiatry. That is clear. Psychiatry, some words to understand, some definition. I'll add psychiatry part, rest are related. Objectives of today's class has been mentioned this part, a basic part of the forensic psychiatry and basic psychiatric jurisprudence. So these are the 6 parts the classes are going to take. Today I'll take only this one, the crime and psychiatric disorders. Mostly asked for the short note in the university examination, Viva MCQs. Even a criminal responsibility short notes are there. For next class I'll take. I'll not touch this one. So number 1, only crime and psychiatric disorder today. Next classes will take law in relation to psychiatric disorders, admission procedure of the patient in psychiatric hospitals, psychiatrist and the court. Now one word has come here, new one is a psychiatry. What is a psychiatry? What is psychiatrist? What is psychiatrist? What is psychiatrist hospital? Or nursing homes. Some new words has been come here to you that will see has been given in the Mental Health Act 1987. What is law related to the psychiatry? So in the past and now, and then past and future of the psychiatry. It is followed all over the India or not? Some parties are still not following Act. What are the changes has been made past and present, and future what will become? You are the future. What you want to make a shape of this psychiatry. So maybe author for me. Mental Health Act 1987. I'll make very easy. Don't make it when you see something act or laws, you find just panic. Don't be panic here. Very simple. I'll present. The Mental Act has been described in a 10 chapter. Now chapters mean you have seen the forensic medicine and toxicology topics had been divided into clinical forensic medicine, legal procedures. Then you find forensic toxicology and medical jurisprudence. Like chapters, again topics has been divided. Here 10 topics are there. We'll take one topic and what are the contents. I'm not going to explore complete the topic like identity. Not only what are the content, like a chapter wise I'll go. So what is the Mental Health Act 1987 enacted? It may be short form user MHA. I may use in a certain time. So MHA, Mental Health Act 1987 is a landmark in the mental health care delivery in India. It is not simply a cosmetic improvement over the outdated Indian Lunatic Act 1912, but represent the conclusion of lengthy presentation of Indian Psychiatric Society to the Government of India. This act come into force in April 1993 as per Government of Indian order. Even though it is still in hibernation in some state that I told, in the future is in your hand. So we'll see what beautifully has been presented. Again, we have to work out on this Mental Health Act and present. So Lunacy Act. Indian Lunacy Act 1912 has no relevance today. So many abbreviations, definitions, words, you will find the definition. Today, as advances in medical science has dictated a corresponding advancement in related legal provisions, insanity was formerly thought to be affected by moon. Hence, the term has come like lunacy, lunatic, the moon related, changes that happens. The Amavas to Purnima, that the Luna means moon. That is lunatic disorder. That's past has been outdated. Nobody has nowadays used. Just when comes this Indian Lunacy Act, that time you can know what is a lunacy. The act was amended, and in short, Mental Health Act 1987, and aimed to consolidate and amend the law related to treatment and care of mentally ill persons, and to make a better provision with respect to their property and affairs. Certain terms defined in this act as described. The outdated term, new terms has come. Asylum used to use. Now psychiatric hospital or nursing home. Lunatic, mentally ill person, mentally challenged. The new term has come. Whenever that has been changed. Criminal lunatic, now mentally ill prisoner. Even medical officer, under this MH 1987, medical officer means a gazetted medical officer in the government service appointed by the state government. Medical officer in charge under this act is the medical officer who, for the time being, is the in charge of a psychiatric hospital or nursing home. That is a medical in charge. A medical practitioner means a person with a recognized medical qualification under the provision of the act. Mentally ill person under the has been a person suffering from mental disorder other than the mental retardation. You have clear cut has been mental retardation and disorder, needing treatment, which has come suffering from only a mental disorders. Mentally ill prisoner. Now here I have word come prisoner. Mentally ill person ordered for a detention in the psychiatric hospital, or jail or other safe custody, and that is a prisoner, mentally ill prisoner. There is a crime and mental disorder is that. So it has been defined whenever word you use mentally ill person, then his detention in psychiatric hospital or jail or other safe custody. A psychiatric hospital or nursing home under this act has been defined. It is a hospital for the mentally ill person maintained by the government or private party with the facility for the outpatient treatment and registered with appropriate licensing authority. License is required to start the nursing hospital and staff qualified in that discipline. That is expert. Admitting a mentally ill to a general nursing home is an offense. Remember that is us. That's why admitting a mentally ill person in only this hospital, admitting a mentally ill person in the general nursing care is an offense under this act, and has been clear-cut mentioned what is the hospital nursing term and requirement. We'll see later. Like medical college has started, what are the requirements? Like a nursing hospital has to start, what has been given the requirements, space, equipment, instruments, nursing staff, that is under this act, medical officer, this learn that you are learning that words, in charge, medical officer. Psychiatrist, again here, a medical practitioner possessing postgraduate degree, PG or diploma in the psychiatry recognized by Medical Council of India. That you know the schedule 1, 2 and 3 part 1 and part 2. So that possesses this qualification, that is called a psychiatrist. Medical officer, that again repetition, went back. The reception order. What is the reception order? Means an order for the admission and detention of a mentally ill person. Reception order. The word will come when we'll go next class, not now, but that time I will use the reception order. What is the reception order? Order for the admission and detention of a mentally ill person in a psychiatric hospital and a nursing home, not in a general nursing home. That is a crime. It is admission and detention. That is reception order. Without order, cannot be detained. Relatives, again relatives in the act, the relative person, any person related to mentally ill person. By blood, marriage, adoption, that is comes relation, the relatives. Now we'll see the chapters that that mentioned that just there are 10 chapter, 98 sections are there, and subsections each chapter. We are not going to all the 98 sections. The some topic part is related to forensic psychiatry that will disclose chapter 4, and we'll see later. Why it has been enacted is a better treatment and care of mentally ill person. That is the MH Act. An act made provision with respect to management of property and affair of mentally ill person. Who will? He is a mentally challenged, ill person. Then who has to? He is not knows the conscious or thought disorders are there, so he cannot manage his affair. So who will the manage? Who has to appoint it by the court order? That in next subsequent chapter, topic and chapter we'll see. Act also provide protection of human right of mentally ill person. That is protection of human right. We have topic we'll discuss later in the non-mentally ill, normal person. So human protection of human rights here also provides the protection for human right of mentally ill person. Chapter 1. Like you have seen forensic medicine, chapter 1, legal procedure, you have seen abbreviations are there. What is affidavit, what is jury, perjury, so many help given to, like summons case, police case, cognizable offense, non-definition, words that you repeatedly use and the clear definitions, commonly used. That deals with, here also, MH Mental Health Act 1987, that has various definition has been there. Here the term mentally ill person is used instead of insane. You remember, or lunatic. So the terms that has been recently, you have seen few words, old words and new words that has been replaced. Similarly, instead of lunatic prisoner, the term mentally ill prisoner is used. Instead of mental hospital, now term has psychiatric hospital, psychiatric nursing home used. In that all definition will come. What are the medical officers, psychiatrists, everything has been defined. Few points we have seen here. Chapter 2, what are the content? Provides procedure in establishing mental health authorities at the central and state levels. Procedure for establishing mental health authorities, higher official, health authorities, medical, paramedic, staffs to establishing. Chapter 3 deals with the procedure for establishment and maintenance of psychiatric hospital. Establishment of size, room, bed, number of beds, that is equipment, everything, nursing homes too. Taking care of everything, that is process, establishment and maintenance, how to maintain. Chapter 4 provides provision of admission and detention. of mentally ill person in psychiatric hospital or a psychiatric nursing home. You remember just how to start the psychiatric hospital, what are the requirements, what is the establishment maintenance. Once everything is ready, then patient comes mentally ill person. That's admission, detention, again examination, inspection, discharge, leave of absences, removal. That has been given a chapter 5, removal of mentally ill person. That is 4 and 5. We'll go detail about in the next class related to forensic psychiatry, admission and detention, reception orders, and so on. So chapter 5, inspection, discharge, leave of absence, and removal of mentally ill person. Chapter 6 deals with the judicial inquisition regarding alleged mentally ill person possessing property, custody of his person, and management of his property. That has been. The civil responsibility, that related responsibility. Says chapter 7, liabilities to meet cost of maintenance. He cannot manage his affair, then who will manage? What is the appointment of that person? Maintenance, liabilities. A mentally ill person detained in a psychiatric hospital, psychiatric nursing home. That's 7th chapter. 8th chapter deals protection of human right. Chapter 9 deals punishments, penal ties with the punishments and procedures. Chapter 10 deals with the miscellaneous particulars are there. We'll see a few points in the next classes. Out of the teacher, we are not going 98 subsection and section, only chapter wise you go, what are the content that it may ask a short note to you. Mental Health Act 1987, right in this chapter you write. Again, just explore this related to forensic psychiatry, chapter 4, 6, 5, 6, and little liability. That's a criminal responsibility related chapter you can add and get present. You can. So we have seen our topic. First will the crime and psychiatric disorder, then civil responsibility, criminal responsibility, detention, and so on the topics. The first topic we today we'll get only limited this one. And next topic. Though we have in the slides. Okay. Traditionally, criminality has been associated with the mental illness. Traditionally, it has been, though there is no definite evidence. The studies of a relationship between dangerous behavior and mental disorder reveals that there did seem to be a greater than chance association between the mental disorders and crime. And common mental disorder associated with the crimes are schizophrenia. A diagnosis and treatment, but just that is psychiatry department will tell detail. What is related to the crime, some limited parts I will take you. These are the mental disorder associated with schizophrenia, affective disorder, epilepsy, personality disorders. Though it is not the mental retardation related to crime, but that doesn't come, that we have okay. Mental retardation, drug dependence, that is a mental illness and a crime. Disorder of the perception. In a crime and psychiatric disorder, first we'll see what are the disorders of perception and disorders of thought, thinking, and speech. Usually ask for the short note. Psychosis and neurosis, there is a difference between, a lot of has been given in the standard textbook. What are the psychosis, neurosis? We'll see next class. Just one before that, we'll start with some few words. What is retarded? In this case, what is the process of retarded thinking? The process of thinking gets slowed down. Retarded thinking. Disorder of the thoughts. So in that, we welcome thought blocking. The process of thinking gets blocked. The person is unable to express. Very simple way has been presented. Don't want to make it complicated. Detail we'll read and discussion. That is interactive classes we have here. Thought blocking, process of thinking get blocked. Thought withdrawal, a person thinks that his thought are seized and feel that thought are removed by external forces. Thought withdrawal. Thought broadcasting, a person feels that, in this case, a person feels that thought are broadcasting or escaping from his mind and followed by or experienced by others. Even thought insertion, a person feels that thought are being inserted into him by some external forces. Verbigeration, senselessly or uselessly repeating some words. Repeating. or phrase over and over again. Perseveration. Perseveration, that is, it means persistent repetitive words or sentence or a phrase beyond the point of relevance. Perseveration and echolalia. Echo means sound, lalia. Repetition, echoing or mimicking the words or phrases that has been heard. Echolalia. Mutism in this, complete absence of speech, mutism. Circumstantiality, a person goes into unnecessary detail in the circumstances and the conversation wander off the point or center theme. However, the person return to the central theme after expressing too many unnecessary detail. Come back, that is, return back to the central theme, that is circumstantiality. And tangentiality here, in this case, here, the person suddenly digress or divert into unnecessary detail of the speech or fact that completely distracted from the central theme. And the person never return back to the original theme after digression. That's unlike in circumstantial, it's return to the central theme, but here doesn't come. Metonymy, here the person use impressive word in place of proper word. Neologism means formation of new words and meaning of the words could not be understood or found in dictionary. Now let's start importance of manifestation insanity, that is mental, which help in the diagnosis. These are the disorder of perception, as short on hallucination, illusions, short notes are there. In disorder of thought, perception is different. Disorders of thought and thinking and speech. This also is delusion, short note, obsession, YYMCQs, impulse, short note, insomnia, maybe it comes in the MCQs, was delirium, short note. These are the list. So it has been presented here. Few point one slide or 2 slides of each. We'll see. What are the first? We'll see disorder of perception, hallucination, illusion, and complete loss of memory. So one is a hallucination, that is also wandering of mind. What is hallucination? It's a false sense of perception. That is disorder of perception. It's a false sense of perception which occur without any external stimuli or external object to produce it. Hallucination, which are only projections of his own fantasy and may affect any senses there. Which are the senses? You know, the auditory, visual, olfactory, gustatory, and so on. Here, auditory, a person hear a voice, even though there is absolute silence. Auditory hallucination, wandering of mind. These voices may be pleasing sometime or maybe violent type. Disorder of perception. Visual, the person imagine a ghost or a beast when absolutely nothing is present in near surrounding. Olfactory, he smell unpleasant or disagreeable odor. Gustatory, without any food in the mouth, he feels good or bad taste. Gustatory. Tactile hallucination, the person feels that some insects, that is tactile, insect, ant, bugs are crawling over the body or his body. In fact, there are none. This type of feeling is also felt by some persons suffering from chronic poisoning, tuberculosis, toxicology topic will be. So, tactile hallucination. Sexual hallucination, a person feels that his penis is in erection and orgasm has occurred even though there is nothing. And psychomotor hallucination, the person feels that some part of his body is moving even though there is no such thing is happening. And person suffering from hallucination may commit suicide or homicide due to defective reasoning. That is, ask for a short note, minimum point has been presented. Those want to grab more marks can go for different standard textbooks and learn again more and discuss for the part, help it written for the interactive classes. Second one, disorder of perception is illusion. You see the picture, just horse or face has been presented. That illusion, the figure may be interpreted two ways. One can see horse or a face. While a normal person realizes after some time that he's looking at an illusory figure. A psychiatric patient may not realize that and may keep believing in that existence of the both. That has been present illusionary images, sometimes circulated on your social forums, WhatsApp and Facebook. You can find that. An illusion is a false interpretation by senses of external object or stimulus which really exist. Notice the difference between this and the hallucination. What is the difference? His perception is purely imaginary in hallucination, but an external object or stimulus does not exist. But here senses interpret this object wrongly. That is the difference. And third one is disorder perception is complete loss of memory or disorderly memory in another important manifestation of insanity, a complete loss of memory. Now we'll see the second part, that is disorder of thought, thinking and speech. Delusion. This is also short note. Repeatedly asked, even Viva questions too. You have to see that. When you see the history taking, you will come to know. Delusion. It is a false belief contrary to the fact. To the patient. This false belief has the force of conviction. Delusion may be of types has been described in standard textbook. Grandeur, exaltation. The sufferer imagines that he is a king, even though he's not. Though he's a beggar on the road, he's not even so rich. But he's feel that he's a king and monarch. But fact is, he's a beggar. Delusion of persecution. The person believes that that people are planning to persecution or kill him. He reacts with the suspicion to every word of his near and dears, like son, wife, and daughter. Persecution, delusion of persecution. People are planning to poison or kill him or her. Delusion of infidelity. The person who is sufferer believes that his wife is not faithful to him, even though she is a good character and conduct. Also, sometimes ask MCQs, there's Othello syndrome, conjugal sin, paranoia. We'll interactive classes time. I will see the delusion topic again. Delusion, nihilistic delusion. The person feels he does not exist with the world. That is Cotard syndrome. The person imagines that his body is no more. Everything is ending now, or ends. Ended. Okay. In short, of depression is noticed. That's all. In a nihilistic delusion. And delusion of jealousy. A person believes that everyone are jealous of his achievement, even though he has done nothing recognizable, are jealous about it. Delusion of self-reproach. That a person blames himself for the past failure or misdeed, which are of no significance. Delusion of self-reproach. That is, a person feels that he has done many sins in the past. Due to that, his career is a failure. A janma, past janma or past happening. In fact, his good conduct and bright achievement in the past. That is a difference. Delusion of influence. The person believes that every action and thought of him is controlled by outside agencies like newspaper, cinema, telepathy, hypnotism. In this delusion, a few words, concise word has been, simple word has been written for writing a short note. We can go any example and n number. So in the influence, person believes that every action has been thought of him controlled by outside agencies. Delusion, there's hypochondriacal delusion. Person believes that there is something wrong with his body and mind that cannot be corrected. Hypochondriacal. Religious, the person believes that he is a representative of God, the God. And all action performed by him are by the direction of Lord. He is a man of purity. These all delusion 19s, you may find more extras in the stand. Maybe ask for MCQs. What I find your standard quiz with 9, I have presented here. So MCQ, even short note, repeatedly, you just memorize. Next is disorder of thought and thinking, obsession. What is obsessive? Word used sometime. That is locking a door, bolting a paper. Even nowadays happening during Corona, hand wash. That is obsessive. It is a constant idea occurring to the person with a resistible force. He is then said to be obsessed that idea. He may try to drive any way of idea from his mind, but he finds that it overwhelms him. The compulsion is the obsessive. This behavior followed the obsession. That is example, washing hand frequently as person feels that his hands are dirty. Obsessive. It happens even normal, 3-4 times, okay. If continued, then that has been labeled as obsessive behavior. Next is impulse. An impulse is a sudden, irresistible urge compelling a person to perform some action without motive or forethought. Short note, maybe ask here. Impulse, sudden irresistible urge. A person has committed suicide. He has impulse and he has done that. That is the impulse comes related to our forensic psychiatry or autopsy that has been timing this. What is the reason for motive behind impulse? The types of impulse has been dipsomania, a irresistible desire to consume alcohol; kleptomania, irresistible desire to steal. Even stolen as object may be a little value, but irresistible desire. Mutilomania, irresistible desire to mutilate, make into pieces. Mutilation. A pyromania, irresistible desire to set a building on fire, or any fire, set a fire, irresistible. Sexual impulses and irresistible desire to perform a perverted sexual act. Suicidal, homicidal impulses and irresistible desire to commit suicide and homicide. In the past, once has been attempted, likely prone to commit in the near future. That is irresistible desire. This is a disorder of thought and thinking. Medical legal aspects in India, we are going to see this in McDonough rules in criminal responsibilities. But in India, it's a criminal responsible because in this responsible is because he knows what he's doing, knows. That is McDonough rules, we'll see, and section 84 IPC. Under the more advanced irresistible test, not followed in India, we will see in the criminal response, next chapter, next topic. So medical legal importance, but here is criminal responsible, what he is doing. He understands everything. He knows that what he is doing. But impulse comes sudden, irresistible desires. So you should know what is the normal and abnormal, then what is the lucid interval. We'll see soon at the end of this talk. Another one is insomnia, a depression of mood, increased mental and physical activity, disorder of thought, and filthy behavior that are some of the other manifestation of insanity. Insomnia. Next is delirium. Maybe ask for short note, viva question. What is a delirium? You may see a person is talking to you in high fever, drugs, oxygen, mental illness, even person consume alcohol, withdrawals in the delirium tremens, that words. So delirium is a state of disturbed consciousness in which orientation is impaired. The critically faulty is critical faculties are blunted and lost, and thought content are incoherent and irrelevant. Here it has come thought, disorder the thought contents are incoherent and irrelevant. So it is a disturbed consciousness. An example, mental stress, drug toxicity, high fever. Lucid interval. A manic phase, you find A and B is shown as in the picture. First see the picture. One A to B is a manic phase and C also manic phase, and between B to C is a depressive phase. There is a clear phase is there. In a two manic phases, there is a depression is there but clear. That is lucidus interval, lucidus clear. A period of clarity of thought between the two subsect bout of mental illness. Manic phase, there is clarity of thoughts. The person may be having a little depression. One must remember that manifestation of insanity not seen during what is called a lucid interval. We talk about in the head injury or in psychiatry, we talk about the lucid interval talk. What does it mean? A clear mind, or that is a normal phase has come in. That is manifestation of psychiatry will not see in this lucid interval, no manifestation. That is advanced, mild, not recognizable. Lucid interval refer to interval or period of time between two bouts of insanity, during which a mind of insane person is lucid, that is clear. In head injury also happens. Unconsciousness of two phase, maybe regain a conscious. Movies are there, very nice movies has been come on head injury, lucid intervals. During the interval, manifestation is not seen and clear mind, and therefore known what he's doing. What he's doing, if a crime, he's responsible for his act during this lucid interval. Has to be proved. Silent feature seen in bipolar disorder between the two subsequent manic attacks. It is also seen in head injury, where it refers to period of consciousness between the two successive period of unconsciousness. The person is responsible all civil and criminal act done during lucid interval. Making a will, entering into the contract, civil, committing a murder, a criminal responsible for his act. So lucid interval will be seen when you are asked when you are discussing with psychiatry and head injury. What is the difference between the head injury? When now comes your topic, next topic we will take on regional injury. That time will come again. So a lucid interval of head injury or insanity of head injury, insanity. History, there will be in head injury of injury to the head, met in accident. Insanity of mental illness. Lucid interval preceded by a phase of concussion in head injury. The phase of symptoms of insanity in insanity, and lucid interval followed by phase of in a head injury, cerebral compression. Recurrence of the symptoms of insanity you will find here, recurrence. But here phase of cerebral compression, that time you will have lucid interval followed by this one. Number of episode only once in head injury. Occurs lucid interval once, but here insanity recurrent. That is very important here. You remember only once. This is the topic next. I want to stop here, have a point discussion. You present a CR will represent to me or group activity. So this topic is a next topic will is civil and criminal responsibility and other topics in next class. I would like to stop here. I don't want to go today's burden. I'm more in psychiatry. Short notes usually ask, MCQ ask, discuss among yourself, colleagues, peer age group. Go a different textbook, interact with. And psychiatry department will take that time, and we have integration classes. That time we'll take exercises, newspaper cuttings and discussions. Thank you. See you. I'm ending the meeting. Thanks.